It's plastic surgery's quick fix. Almost 200,000 women now undergo liposuction every year. But many women still consider this popular procedure too invasive, with too much downtime recuperating. Until now. The latest generation of liposuction, less invasive with faster recovery, makes it an option for even the busiest working women and moms.
I'm Lisa. I'm a mom of 3, and lately I feel as if I got 3 chins. I'm 46, and I look at myself in the mirror and I look at my chin. I feel like a senior citizen, and I feel like this is my aging area right here. I've tried lotions, potions, and creams, but absolutely nothing gets rid of this droop. It's come to the point in my life now that wherever I am, I'm looking at other people's necks. I certainly do have neck envy.
This new technology gives us the ability, that sagging skin, we can just shrink it and you'll have this really tight, beautiful neck. It really will allow Lisa to have minimal bruising, minimal downtime, and they're back to work right away.
Board-certified plastic surgeon Dr. Stephen Davis is on the cutting edge of this new procedure. It's called body tight or neck tight. So Dr. Davis, explain to everybody and to me why you think this body tight or neck tight procedure is better than traditional liposuction.
Liposuction has been around a long time, and it does a great job at removing unwanted fat. But there's 2 things that has never been really addressed: loose skin and getting people back to work right away. The body tight and the neck tight uses radio frequency energy, and it helps shrinks the skin at the same time that you're removing the fat, and it allows me to have my patients on the Dr. Oz show in less than a week.
Sounds pretty good. There's her picture. So she has a little bit of sagging skin under her chin in her neck area. All right, so let's take a look at the new Lisa. Are y'all curious? Yeah. All right, Lisa, what did the neck tight procedure do? Oh my goodness. Come on down. Oh my goodness. Are you happy with that result?
So happy. I had nothing to grab anymore.
I mean,
nothing there.
It really looks wonderful. Did it hurt when it was being done?
Not at all. Didn't feel a thing.
So what do you think when you look in the mirror and you see that?
I think it really takes at least 10 years off my age. It really does.
All right, thank you very much.
Oh, it's a pleasure. Thank you. Thank you.
Angela as well.
If you're looking for a dramatic change, but don't want to go under the knife, my next guest has answers for you. Here with the latest in less intensive cosmetic procedures, please welcome plastic surgeon Dr. Nicholas Nikolov. Doctor, let me ask you, can the results of non-invasive procedures really be as good as surgery?
Absolutely. For the right chosen patient, I can get as good of a result using a minimally invasive or a non-invasive device, like some of them we're going to talk about today, and those devices can make you feel good and no scars.
Ladies, I'm telling you, sit up. What's your first procedure for getting a great summer body?
The device that we're going to talk about is neck tight, face and neck tight, which is a radio frequency device from Invasics. And that device allows me to tighten the skin and also to selectively remove fat from the neck and contour the neck.
Really? Okay, we have a woman who has had the procedure done. This is Monica before. All right, now let's see her now. Come on out. Wow. And that's no cutting?
Well, that is just a needle going through the skin, and the probe allows for tightening the skin as well as destroying the fat. Strong words, but that's what it does. And contouring the whole area.
That was a wow photo, right? Yeah, they like that. Thank you, Monica.
Thank you.
Thank you, Dr. Nikolov.
All right, Jose, thank you. It's 8:40 right now. There is a new procedure that promises to tighten sagging skin and also reverse the appearance of aging, and it's less invasive than a facelift, which means no scalpels, no scars, nothing like that. Dr. Ernest Layton is a board-certified plastic surgeon, and he joins us live in our studio to talk to us about FaceTite, T-I-T-E. Good morning to you, doctor.
Good morning.
So tell us about this procedure and how it all works.
Well, it's InMode is a medical device company, a cutting-edge medical device company that has come up with a minimally invasive way to actually tighten skin. It's using radio frequency energy, which we've always known that radio frequency worked. The problem was getting it to the right tissue level without causing damage to the overlying skin or tissue that you didn't want to damage.
Okay.
And they've come up with a way, it's kind of a dual probe where a wand is placed underneath the skin and one above the skin, and the radio frequency energy is transmitted between the two devices, causing heating of the skin, shrinking of the actual skin itself, shrinking of the septa that connect the skin to the underlying tissue, and also reducing fat. And it's a kind of a minimally invasive, I wouldn't call it non-invasive, but it's certainly short of a full-blown facelift. So
as soon as you mention that tissue really heating up, I automatically think pain. Is this a painful procedure?
It's not. It's done in the office under local anesthetic. Sometimes a little bit of sedation can be given as well.
Yeah.
But it's certainly less invasive and painful than a full-blown surgery.
So if it's not too painful, when can you expect to see results? Is it something that you just walk out and automatically see something? Or?
You actually do. The skin actually shrinks before your eyes, and you see some skin contracture immediately. Afterwards, you may get a little bit of swelling, and probably 5 to 6 weeks, 6 to 8 weeks are the best results. But it's actually been shown in studies that the tightening continues up to a year afterwards.
So I would assume anything that requires you to be sedated, you know, if you need that kind of thing, it may pose a little bit of a risk. Is there one when it comes to this procedure?
It's very minimal. There is, you know, you can get some swelling afterwards, some bruising afterwards, but it's very minimal risk. I mean, you're doing it awake. Some people have the fear of actually going to sleep and undergoing a big surgical procedure.
Right.
So.
All right, doctor, thank you so much. We're out of time. We got to let you go.
Great. Thank you very much.
I got to check the weather right now with our Lisa Vaughn.